Hello, I'm Shelby. I'm going to be your nurse today. Just give me a moment before we get started. So I'm washing my hands and I'm closing the curtain for privacy. And I'm going to don gloves. Can you tell me your name and date of birth?
Tom Johnson, January 3rd, 1989.
All right, I'm going to verify by scanning his wristband. So your doctor has ordered a neurological assessment for you. I'm going to perform that today. Do I have your consent to proceed?
Yes.
Okay. And can you tell me your name one more time?
Tom Johnson,
And where are we?
clinic,
And can you tell me the month
April.
and the current vice president?
Mike Pence,
All right, so what are we doing today?
a neurological exam ordered by my doctor.
And I am going to tell you 3 words, and those 3 words are mountain, engineer, and turtle. Can you repeat those words back to me?
Mountain, engineer, turtle.
All right, so later on I'm going to ask you to repeat those words to me. And can you tell me the name of the former president?
Barack Obama.
And the one before that?
George Bush.
And the one before that?
Bill Clinton.
So he's alert and oriented times 4. His immediate and remote memory is intact, and the recent memory will be determined. I'm also taking into consideration any culture. All right, so we're going to move on to the motor exam. I want you to put your arms up to your chest, kind of like a monkey. All right, so I want you to resist my pressure. Good. All right, put your arms up like you're doing a bicep curl and resist. Okay, great. Show me your hands and resist again. Very good. Now I want you to do your best to squeeze my 2 fingers as best as you can. Very good. All right, so I want you to separate your legs from me. I'm going to try to pull on your lower leg, and I want you to keep it stable. Good. Okay, and I want you to point your toes up towards the ceiling. And I'll push down, resist, and point your toes down. I'm going to try to push them up. Very good. All right. So his grip strength is strong bilaterally. His muscle strength is equal and strong bilaterally in both upper and lower limbs. And now we're going to check some deep tendon reflexes. So I'm going to get my little reflex hammer. All right. So I want you to dangle your leg off the table and relax both of them. Okay. And right here. All right. So that's the patellar reflex, and the patellar reflex is a 2+ expected response. So now I'm going to check the biceps tendon. I'm going to relax. Very good. So the biceps reflex is a 2+ expected response. And then finally, I'm going to check the brachioradialis, and I'm going to locate the styloid on the radius and go about 1 inch or so up from that. And relax your arm completely. Relax. Okay. And the brachioradialis reflex is also a 2+ expected response. And if I did have trouble eliciting any responses, I would just say unable to elicit the response. I wouldn't necessarily assume that he's not able to elicit the response until I really kept trying. So now we're going to do the Romberg test. So if you will stand for me with your feet together and your arms at your side and step away from the table. Okay, good. And now I want you to close your eyes. So I'm assessing for any swaying or movement. And go ahead and open your eyes. His balance is intact, the Romberg sign is negative. So now I'm going to do a gait assessment and motor function and coordination. So first I want you to do some movement exercises for me. I want you to walk just back and forth right here on your heels. Good. Now I want you to walk on your toes. Good. Now can you walk heel to toe like you're on a tightrope? Very good. All right, now you can go ahead and have a seat again. That's the upper extremity motor function and coordination. So can you touch each finger to your thumb as fast and quickly as you can? And again. Very good. Can you touch your nose and then touch my finger? Touch your nose and my finger. Again. Again. Good. All right. Now can you take the heel of one foot and rub it across your shin of the other foot? Okay, and then do the other side. Very good. So his gait is steady, his motor function is balanced and normal. He has good upper and lower extremity coordination, and it's certain and smooth. All right, so now I'm going to test his sensation. So I want you to go ahead and close your eyes and tell me when you feel light touch by saying yes.
Yes. Yes. Yes. Yes.
Okay, very good. Keep your eyes closed. And I want you to tell me when you feel something sharp by saying sharp, and I want you to tell me when you feel something dull by saying dull. Okay?
Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp.
All right. Very good. So his sensation to light touch is intact, and his sharp dull discrimination is also intact. And can you tell me those three words?
Mountain engineer turtle.
Very good. So his recent memory is also intact. And judging his mood and affect, he's calm, cooperative, he's responding to questions, he has no inappropriate reactions or responses. So for the cranial nerve part of the exam, I'm going to test cranial nerve 1, the olfactory nerve. Go ahead and close your eyes for me, Tom. I want you to tell me what you smell.
Vanilla.
All right, go ahead and close one nostril and tell me what you smell.
Smells like lemon.
And close the other nostril and tell me what you smell.
Smells like peppermint.
All right, his olfactory nerve is intact. So now I'm going to check the optic nerve, cranial nerve 2. Go ahead and stand 20 feet away from the Snellen chart. And I want you to cover your left eye and read the last line.
LPED.
And cover your right eye and read the furthest last line.
LPED.
All right, now uncover both eyes and try to read that last line.
Looks like LPED.
All right, very good. You can go ahead and have a seat again. So I was checking for the visual acuity, and I was also screening for myopia. His visual acuity is 20/20 in the left, 20/20 in the right, and 20/20 in both eyes without correction. So you are not wearing any corrective lenses.
No.
Okay. So now I'm going to do a confrontation visual field test to check peripheral vision. So can you cover your right eye? And I'm also going to cover my eye, and I want you to keep looking at the eye that's not covered. And I want you to tell me when you see numbers on my fingers and how many fingers that I'm holding up, okay? But keep looking at my eye.
1, 3, 2,
Okay, I'm going to cover the other eye. And we're going to do that again.
2, 3.
All right, So all the peripheral fields are full bilaterally, and the optic nerve is intact. So now I'm going to assess cranial nerve 3, 4, and 6, the oculomotor, trochlear, and abducens. I'm assessing for ocular motor movements, and I'm going to start by doing the corneal light reflex test. So I'm going to shine the light, keep looking straight ahead for me, Tom. I'm going to shine the light on the bridge of his nose, and the reflection is symmetric in both corneas. And now I am going to screen for strabismus. So I want you to cover your left eye for me, and I want you to turn and look towards that corner. And keep looking and uncover your eye. All right, good. Now I want you to turn and look at this corner and cover your eye for me. And keep looking and uncover your eye. All right, he's negative for strabismus. Now, without moving your head, I want you to follow my pin light. All right, I'm going to move it in several directions, and I just want you to follow in each of the directions. Okay. So I'm screening for nystagmus, and he was able to move his eyes without moving his head, and the movement was smooth and symmetric, and all eye movements were in 6 cardinal fields of gaze. All right, so now I'm going to dim the lights, and I want you to stare off at the wall, and I'm going to shine a light into your eyes, okay? Just keep staring off at the wall. So that was a direct response. And that was a consensual response. All right, so I'm going to turn the lights back on, and I want you to follow my finger, look straight ahead. All right, so that's checking for accommodation. So now I could document PERLA, and that stands for pupils are equal, round, reactive to light, and accommodation. And he was reactive to light directly and consensually, and the oculomotor, trochlear, and abducens nerves are intact. So now we're going to check the trigeminal and facial nerves, cranial 5 and 7. So what I want you to do is bite down and clench your teeth. All right, so I'm palpating the temporal and masseter muscle is nice and firm and tensed, both the masseter and temporal muscle. All right, so open, okay? I want you to bite down and close your eyes, and I want you to tell me when you feel light touch. Keep biting, and good. Can you puff your cheeks out? All right, can you squeeze your eyes together? And can you smile and frown? And can you go ahead and look to the side? And so this is the corneal reflex test. To check the corneal reflex, I'm going to take a tiny little wisp of cotton and twist it to a point and gently touch the wisp to the cornea and see if you can feel it. So I want you to raise your hand when you feel something, okay? Okay, turn towards this side. All right, very good. So his facial movements are symmetric and the strength is intact. On eye closing, his corneal reflex response is normal, and so the trigeminal and facial nerves are intact. So now I'm going to test the vestibulocochlear nerve, which is cranial nerve 8. I'm going to do that by doing a whisper test. So I want you to tell me when I'm whispering. Cover the right ear for me.
Zebra.
Very good. Cover the left ear.
Caribbean.
So the vestibulocochlear nerve, the hearing is intact. All right, now I'm going to check cranial nerve 9, the glossopharyngeal nerve, and I am going to take, all right, so open and stick your tongue out for me. Good. Now say ah.
Ah.
Okay, and say ah again.
Ah.
So the soft palate and uvula rise with phonation, The uvula is midline and symmetrical, and the gag reflex is present. So the glossopharyngeal nerve, cranial nerve number 9, is intact. All right, so now moving on to the vagus nerve, cranial nerve 10. Can you swallow for me? All right, so swallowing function is normal, the gag reflex is present, vagus nerve, cranial nerve 10 is intact. And now for the cranial nerve 11, the accessory nerve. Can you, I'm gonna put my hand against your face, and I want you to try to turn your head to the left as I resist. Good. And then to the right. Very good. Okay. And then I'm going to have you shrug your shoulders against my resistance. Okay, good. And then I want you to move your head side to side. All right, good. So cranial nerve 11, the accessory nerve is intact. Now the final cranial nerve is the hypoglossal nerve, that's cranial nerve 12. Can you stick your tongue out? All the way. Can you move it side to side? All right, can you say Methodist Episcopal?
Methodist Episcopal.
And unique New York, unique New York.
Unique New York, unique New York.
So the tongue protrudes midline, his speech is clear, and he can enunciate properly, and the hypoglossal nerve, cranial nerve 12, is intact. So I'm gonna wash my hands, taking off my gloves, and the bed is all the way down to the correct position. The guardrails are up, all 3 of them. His call light is within reach. The head of the bed is to where he wants it. And is there anything I can get for you before I leave?
That's it. Thank you.
All right, thank you, Tom. Thank you for your participation. And now I'm gonna go document.